Firstly, thank you for your interest in this webinar and the topic of data analysis. Today we'll just have a light touch to introduce some concepts and some ideas without going too deeply into techniques or formulas. So it's aimed at those with some basic analysis skills and those with some desire to learn about a couple of new topics. I'm a social statistics advisor, and social statistics covers pretty much everything that is not finance and economics in nature, and it focuses around the population, human behaviour, human services, the big ones being health and education. But really data analysis has overlaps no matter what the subject or the thematic area is, and the concepts that you learn in one area translate fairly readily into all aspects of data analysis. Now, analysis skills obviously can come from formal training at the tertiary level, but a lot of it does come from on-the-job training. And increasingly now there's a lot of online resources that you can find and pace yourself if you're interested in specific topics. So let's get started. Here's a little truism. So the population is kind of split into two groups of people. I'm hoping those of you on the call today are in that first group who can extrapolate from incomplete data. But when you're analysing, and especially when you're writing up results, it's usually wise to always err on the side of over-explanation and assume that your audience is in that second group of people that can't extend from incomplete data to imagine the full story, and that usually serves you quite well. Here's a few things I always try and keep in the back of my mind as I start a new piece of data analysis. So we heard this morning that data on its own has quite a low value, despite it being incredibly expensive to collect. And before we start, it's a good idea to consider, do we need to clean the data and assess its quality, because that determines what we can do with the data. And sometimes you'll face circumstances where you might find conflicting data, so different answers for the same issue that you're addressing. And you need the skills to think and determine which one is the most reliable or accurate or appropriate to use. And it's not necessarily something that can be taught. It's something that as you get more and more experience, you understand the intricacies and the advantages and disadvantages of different data sources, and you can apply that knowledge. And again, this morning we talked about identifying what you're trying to do before you start your analysis and determine your outputs. And if there is a target that you're trying to report against, definitely use that to frame what you're doing. Often subject areas will have certain ways of analysing and discussing data. And it's a good idea to know and be aware of what's expected of you. So if you start interpreting data or expressing it in a different way, say per 100,000 instead of per 1,000, you're going to confuse the user that's used to seeing a specific way of data presentation. Another risk in analysis is to overinterpret. So put more emphasis or result into the data than is warranted. So yes, work out what the data is saying, but don't over-interpret. The dimensions of the data itself can also determine what analysis you end up doing. So here's 3 dimensions of data: the source, the type, and the nature. So in Pacific countries, a lot of your data that you'll have comes from census and household surveys. And these are good, they're very comprehensive, and they contain a wealth of variables with which you can analyse. Administrative data refers to some of that transactional or service data. So in your government agencies, the classic examples would be from education, where you have student enrolment records and performance records, and in the health system. So you might have hospital admission data and death data. Community data is a smaller component, and that's where people out in the general public collect data and send it through to a central repository. So something like collecting weather information or ocean acidity from their local ocean. Big data is still fairly new in the region, and that's where we might do something like web scraping of social media accounts to see what people are talking about, or using mobile phone tower data to see daily mobility of the population. But there'll also be some data sets where you don't know where it's come from, and that's where you have to be really cautious in how you apply that data, because we don't know much about its quality or how it's been collected. But always feel free to go to your stats office and say, I'm using this data. Can you tell me how it's been collected, and is there anything I should be aware of? The type of data that typically also relates back to the source. So a census, we have complete coverage, ideally. So every person in the population has been captured. Sampled data, which is our survey data, can be as reliable and good as a complete coverage if the sampling has been done well. There's also data sets where it's incomplete because the coverage has been poor, and it can lead to bias. And again, if we're using these data sets to make inference, we have to explain to the user that there are some limitations. Non-structural data would be things like satellite imagery, pictures where we take a picture of the house when we do the census collection. And some data sets, it'll just be a one-off. Some it might collect 4 times a year, so we have some seasonal data. And when we're looking at things such as indicators, it's important to be aware of the nature of the data. Is it country data, which is exactly as the country has provided? Or often in global data sets, your individual country data that you've submitted may be adjusted so that every country is comparable. And in cases where there's not annual data available, or the data is quite old, often you'll find modelled, estimated or forecast data. And that's fine to use as long as you understand what modelling or forecasting has been done, so that then you can appreciate the quality of that data. The take-home message from that previous slide was simply just to know and understand your data, because that will guide you in what you can use it for and how you interpret it. So moving to an actual data set, population data. It's one of our most used and useful pieces of information, and it's something that humans have been collecting for over 6,000 years. So on the face of it, population count seems very straightforward, but there are some things that you need to consider and understand within your own country setting. Who is included in that count? Is it everyone that's in the country on a certain day? Or is it related to how people perceive their residency, or which is their home country? So some common groups that might be included or excluded depending on the purpose. People like international students who might be in your country for up to 3 or 4 years, but they would go home for their holidays. Visitors. Typically you would think, well, they're not counted in our population, but maybe there are instances where it's useful to include them. For instance, if you're planning how many masks do we need for the COVID pandemic, you would want an idea of the volume of visitors, because you may also need to supply to them. And groups like the military or seasonal workers, where they might move between countries depending on the nature and the timing of work. Where do they get counted? Where they usually reside, where they were born, or the country that they're working in? And again, that might depend on definitions of who's a resident. And what about people that are usually in your country but might be overseas temporarily? Again, just for holidays, for study or for work? Do you have a mechanism in which to capture those people? And do you want to report them in your country? Should they be reported in the country that they're living in at the moment? Or maybe they're excluded and missed out altogether from both home and destination country. Once we've got that population definition sorted out, the most important and useful aspect is population by age and sex, because that lets us calculate so many more indicators and get truer rates than just using a total population. We can also use that age and sex information to assess the quality of the collection. So with a sex ratio, we expect as babies are born, we get roughly even numbers between males and females. But as we get into the really old age groups, because women on average tend to live longer, we'd expect to see more females than males. So looking at patterns like that can let us see if we're getting the expected outcomes. But again though, be aware you can get anomalies in that. For instance, going back to that military concept, if you've got a large military base, such as in the Marshall Islands, you might expect to see more males in some of those younger adult age groups. You'll also often find you'll have some people who don't state their age. And how do we treat them? We don't want to exclude them from the population because that's losing information. One of the common things we do is to distribute those age not stateds, assuming that they follow the same pattern as the general population. So we use what's called a pro rata distribution. Let's say if in the general population 5% of people are aged 50 to 54, then we assume that 5% of those people who didn't state their age are also aged 50 to 54, and we redistribute them into that age group. Now the last thing to consider is what population do we use? The most common one would be your recent census count. But if your census was 7, 10 more years ago, and you've got a rapidly changing or growing population, then you're going to mislead by using that, what we consider an out-of-date population. So there's a couple of options. You can take that census count and add in births, deaths and migration for your administrative data, or often there'll be a population projection which attempts to account for that change over time. Let's look now at some of the most common population statistics that are produced. Median age gives us a one figure to summarise the age pattern in a population. So it's the age where half the people are younger and half are older. The sex ratio compares males per 100 females, and again that can be done for the total population or within the age groups. And it's worth noting when we're talking about populations we express it as males per 100 females, but if you're doing gender parity work then the indices use females per 100 males, so that's just a little trick to be aware of. The dependency ratio again is a common indicator, and that's a rough estimate of what's the size of the dependent population, so the children and the old people, expressed as a proportion of the so-called working age, so nominally those people aged 15 to 64. And obviously that's an estimate because not everyone in the working age will be working, and not everyone 65 and over will be dependent. So that's the international definition. Also be aware that in the Pacific some countries have contextualised that and use a dependency ratio where the working age is those aged 15 to 59 to reflect the younger retirement age. So if you're submitting a dependency ratio into a global database, you're probably safer to use that international definition. Growth rate is another very popular statistic, and that's where we look at what is the annual rate of change, typically between two census counts. And that rate of growth can then be applied to the population for the next year, 2 or 3 years out, to estimate what the population will be. But beyond that, a growth rate is not a very good methodology to use because rates of growth change quite rapidly. And a couple of other rates you'll see are things like urbanisation rate. So we're interested in, is the urban population growing faster than the rural population, or vice versa? And population density is just where we divide the total population by the land area to get an idea of how crowded an area might be. And it's often more useful to do that at subnational level as well. Population pyramids are a common way of displaying the age pattern in a population, and you've probably seen them in many publications. We can characterise populations in effectively 5 ways. If we start with the left, we have a very steep-sided triangle, and in a pyramid we always have males on the left and females on the right. So starting here, this would be a population that's still growing quite rapidly. We have very high fertility, but also very high mortality. You can see above age 65, we've got very few people. Moving on again to a more regular-sided triangle, this is still a high growing population with high fertility, but slightly less than this first one. Starting to see some improvement in mortality, but still a young population overall. We then move on to what we call a beehive pyramid. So we're starting to see some tapering off in fertility, but also much more improvement in mortality. So we're seeing more and more of the population in these older age groups. We then move on to the next stage in the demographic transition where fertility is dropping off even more. So we've got fewer people now in these young age groups, and the bulk of the population is in this working age. The final representation, which is sort of typical of what you'd see in somewhere like Japan, where the population is relatively old, really cut away at these younger age groups, and the bulk of the population in this top half. So that's in demography what we call a coffin-shaped pyramid. So just reflect on what you think your country might look like in terms of where's your fertility and mortality levels at. And in practice, you'll never see something as smooth as this because migration also has a part to play, and you'll get gaps in certain age groups, particularly young adult age groups, as people move out to study or to find work opportunities overseas. So that's looking at the whole population. In the last slide we looked at median age, which was our summary indicator. So before I put the slide up for the Pacific countries, just quickly think what you might imagine your average age of your population is and see how close you are. So here's our estimates for the Pacific. Solomon Islands coming out with the youngest population. So half of the people are aged under 19. We go up to Palau at the other end of the scale where the average age is nearly double. So the average age, or sorry, the median age, get my terminology right, the median age is 38 years. So these are just a couple of ways to show your data. Let's jump back to median age just quickly and look at how we calculate that. Very easy if we have single age data and we just rank that population from youngest age to oldest age, like in this diagram here, and then we simply remove the youngest and oldest consecutively until we're left with our middle person. So this happy fellow here is our median age. In practice though, we generally are working with group data. So your population might be only available at 0 to 4, 5 to 9, etc. And it's the very same principle, but an extra couple of steps are required. So let's bring in some sample data. Here we have our grouped ages, and this is the number of people in those ages. So we have 82 people aged 0 to 4, up to 148 people aged 45 plus, and a total population of 747. So we need to find who is the 374th person, because they're going to be our middle person. So we need this extra column, which is our cumulative total. So for 0 to 4s, we've got 82 people. Our next line we want as the sum of 0 to 4 and 5 to 9. So it's our 82 plus the 71 that are aged 5 to 9, gives us 153 people aged 0 to 9. The next row, same deal, we have our 153 people plus the new lot aged 10 to 14, giving us 218. So we need to keep going until we get to a cumulative total that surpasses our 374. And you can see that's going to be somewhere in that 25 to 29 year group. So with a formula, and I'm pre-prepared, so I've got the numbers already put in. So our median, we want the lowest age of that middle group, which is our 25. So we have 25 plus n, which is our total population, 747, divided by 2 to get our middle person, and we subtract the cumulative total of the age group preceding that, which is our 329, and divide it by the frequency in our middle group, which was our 62 people aged 25 to 29, and we multiply that by the width of the age group, which is 5. So we've got 5-year age groups. And that gives us a median of 28.6 years. But we typically round that up to 29 years. In practice, you probably won't be doing this by hand. You rely on your friendly Excel spreadsheet, but it's always nice to understand what's going on in the formulas. We'll introduce health data now, and health and population data work really well together. So often when analysing health data, we want to relate illness and the risk of catching a disease or the risk of dying to the population at risk, so that we can get a true indication of the level of health or ill health in a population. So our child mortality measures, which are some of our Sustainable Development Goal indicators, we express those as the number of events per 1,000 live births. And our accrued death rate, we use the total population as the denominator. And another thing to bear in mind when we're using health data in the Pacific, because we have relatively small populations and some health events are rare, so they don't happen all that often, we like to do what's called smoothing. So for those small events or rare diseases, we often look to combine annual data over a longer time period, 2, 3, up to 5 years. And that means instead of having very erratic rates over time, we get something that's actually more meaningful and more useful for policymakers. And as you get more advanced in using health data, there's also another technique called standardization, and that's where we actually account for the age pattern in the population, because we know, unfortunately, with increasing age, the risk of illness and unfortunately, of death increases. So if we want to say what's the true level of ill health, and we want to know what's the impact of communicable diseases, the state of the health system, the state of prevention or lack of prevention. So we want to make sure that it's not the age of the population that's influencing our statistics, but it's actually those other external factors that impact on people's health. So let's now look at COVID data. It's very topical and it's really brought statistics to the forefront of everyone's mind. So it's not only policymakers that are interested in COVID data, but also the general population is after daily updates, especially when we're in the peak of the pandemic. So let's look at this sample data here. We've got daily case numbers, so we've got some actual numbers, and across this axis we have the time, which is in days. So I'll just ask you to pretend that you're working in the Ministry of Health and your minister has asked you for a briefing on this data. So just have a little think about what stands out from the data, what other things you might like to know, and how you could present this to actually assist in making some determinations about the state of COVID in the country. And don't worry, because we're not face to face, I can't pick on any of you to respond. So just do this for your own interest. So what value can we add as an analyst? I'm guessing you've already noticed that there's a lot of variation, and we can look at that graph and it's not immediately clear whether things are increasing or decreasing, or what's happening over time. Immediately obvious are these regular days where there's 0 cases, what we call donut days. And if we look a bit further, we can see that they happen at a regular interval every 7 days. So we could guess that something's happening in the data collection rather than that being a true reflection of COVID cases. And indeed, if you look up the calendar, you can see that that's a Sunday each time. So it's a good assumption either testing's not happening or the person recording the cases into the database doesn't work on that day. And that's why we see these kind of big jumps on the days afterwards, where there's probably some catch-up cases being recorded. So that's one thing that you could mention. Now just think back to the previous slide, and I talked about smoothing the data. So a nice thing we can do, because it is so erratic day to day, is we can introduce a moving average, where I'm taking blocks of 7 days and rolling that forward a day at a time. So this first value here is the average of 11, 29, etc, 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 up into this 7th day. And then the next point on this curve starts at day 2 to day 8. And you can see now we've got a lot more obvious a pattern. We can definitely say that the case numbers appear to be increasing over time after this little drop down. And that it's obvious now we've got something we can report on and give indication to our leaders what's happening. Another thing that's nice to do if you're presenting data is to combine a few bits of pieces on the same slide. So we can have our case numbers, we can overlay the number of tests that occurred so that we can also comment on whether it could be a drop-off in testing that means the case numbers are going down rather than that it is actually a true reduction in the number of cases. And this is also nice because this person has identified on the timeline some of the key impacts on COVID cases. So our first case confirmed, but also some interventions that the government has introduced. And this, it's a nice way to combine something into a visualization rather than putting all that out in sentences, which then the person has to read the sentence, look back to the graph to see where that impact occurred. This is just another example of how COVID data has been disseminated. You can see it's a very simple 6 boxes, but all the key data's there. And I think it's easy for people to understand. And it's used colour to link relevant related information. So our pinks show us the hospital impacts, and the oranges are our case numbers. So cumulative cases, cases in the last day, and also a 7-day incidence rate. So again, the same idea as in the last slide where we smoothed it on a 7-day rolling average. This incident rate takes what's happened over 7 days, divides it by the total population. So who is at risk of catching COVID? That's the total population. So the number of cases divided by the population and expressed per 100,000. So this is from New Caledonian government, and this incidence rate has great significance because it's what determines day-to-day settings in terms of are people able to gather in groups of a certain size, do businesses open, is mask wearing needed. So as you've probably seen in your own societies, data analysis and statistics has really determined how people live. So it's been a really valuable use of analysis. Vaccination data has also become increasingly popular. Earlier on it was all about vaccine supply and tracking which countries were getting what doses and what sorts of vaccines. Then it moved on to the interest being in the number of doses that were being put into people's arms. And more recently it's become about knowing how many people are fully vaccinated. Now, of course, you also need to be aware if you're working on this vaccination data, what segments of the population are eligible to be vaccinated. So if we're looking at proportion fully vaccinated, we want to know what stage the country is at in terms of, is it people 18 and over that are eligible, or is it reached down to now children 5 and above are eligible? So just make sure that the population you're using is the right one. In displaying vaccination data coverage, these donut graphs have been fairly popular around the world. Here's an example using data from French Polynesia. So the green segment of the donut shows what's been achieved. So 78% of people having received at least one vaccination. And I think these are a good way to display it because it suggests a movement. We're going around the circle, and the grey clearly shows what's still left to achieve. Another option, if we take data from Kiribati, is to show one vaccination and then the second dose as an inside ring. So again, it's showing the proportion that have received one dose, no dose, and also a second dose, but also by elimination, how many of that have had the first dose have not received their second dose. So it tells us a lot in one simple chart. Another consideration with our vaccination data is to assess what the risk of infection is between the different groups, so those that have been vaccinated and those that haven't. And this is something that's been particularly poorly done by a lot of the media reporting, but it's an area where you as an analyst can contribute to the conversation. So if we imagine our population is 100 people and we have a vaccination rate of 85%, the way it's typically been reported in the news, if we have 4 infections across those two groups, say 50% of infections were among the vaccinated. And that gives quite a misleading picture to the population and certainly doesn't encourage those who are unvaccinated to go and get vaccinated. But if we actually look at it in terms of its relative risk, so we said each dot here is a person, so we have 85 people in the vaccinated side and 15 in the unvaccinated side, given our vaccination rate of 85%. You can see we've got 2 red dots being those infected and 2 over here. So yes, 50% are in each group, but the relative risk among those vaccinated of becoming infected is 2 over 85 versus 2 over 15 in the unvaccinated. So here's where a bit more understanding of how to use and interpret data can come in handy to actually influence in a good way. Another graph I've seen which I thought was quite good, sorry for the quality of it, and again using dots, but this time proportional dots. So this graph is showing for certain vulnerable populations, which are the lighter colour circle, against the general population, what the relative risk is for developing a severe case or from dying from COVID. So again, that would, if we were to write this out, it would be quite a long paragraph and possibly hard for some people to understand what you're talking about. But here, if we say the risk in the general population is this size, and it's 4.5 times more risk for people living with severe housing issues. And yet when we get down to food insecurity and poverty, it's still more risky for those groups, but not as substantially different to the general population. So this, again, it's just a way to think about how do you portray your data in a way that a non-statistics person is going to appreciate. Continuing on that theme of visualizations, they can often tell the story with more impact and indeed leave a more lasting impact than reams of text and tables. And again, it depends on what sort of product you're producing and what the audience is. Often with briefings or conventional reports, you do have to be a bit more conservative in how you present the information. But if it's something for general consumption, it can often help to add in some nice little visuals. So let's imagine I've just taken a poll and asked you what you would rather be doing right at this minute. Here's a basic but quite boring pie chart. This is just your standard output from Excel. But with just a few more minutes of effort, Again, using Excel, I've just tried to make that pie chart a bit more interesting. And that's simply by including the question at the top, making a little feature, using some colours that aren't your standard Excel graph colours so that it doesn't look like every single graph you've seen before, and adding in the labels and the percents right next to the category so you don't have to switch between reading here, going to the colour. So something like that chopped into a page of text is immediately going to draw the user to read that. So for something that's your most important point, always consider having some sort of visual aid. And now to graphs. And which sort of graph should I use to visualize my data? Does it matter? Actually, yes, it really does matter. Choosing a type of chart that doesn't work well with your data can mean ending up with you misrepresenting or skewing your data. And again, you also don't want to overcomplicate the graph and detract from the message that you're trying to show. So here's a bit of a quick guide with credit to Venngage, who I've stolen these from. Again, it depends what the purpose is. So if you're just trying to inform, you want to convey one piece of information, you might consider just showing that one big number, or the donut charts that we looked at with the vaccination data, or a simple pictograph which just shows one proportion. So here's a pictograph example from our 2018 Regional Sustainable Development Report, where we're highlighting the key message from SDG Goal 1 on no poverty. So we're showing our 4 people and highlighting the one person who is our representation of poverty. So this is a nice way to summarise what could be a whole chapter of discussion, and indeed there's a whole realm of analysis that sits behind this, but for some people that aren't going to read through that, this is a nice way to highlight and have a takeaway message from all of that work. Now if we want to move on from those simple one data point messages and we want to compare or contrast, there's a lot more sort of standard options that we might consider. So bar charts, yes, they're very common, but that's for the reason that they are effective. We can compare categories, compare countries, compare over time, compare subgroups. And we can also stack to include that time comparison. Bubble charts are also quite popular, but again can sometimes be a bit more tricky to interpret. And that's where we might use the size of the bubble to show one of the variables. Tree maps are also becoming more common, and that's where instead of a bar chart to show the categories, the size of the box within that overall box shows you the contribution of a category to the total. And as you saw up in our opening poll, we used a word cloud. So depending on the frequency or the number of people saying that word, it takes on a bigger size in the graph. If we want to describe change, and predominantly change over time is one of the key things you would be interested in, but also change by location. So we have mapping options, but typically a line chart is the preferred method to show change over time. We have time on the x-axis and rate of change on the y-axis. And again, all of these charts are readily available to produce in Excel. For a timeline as well, that's always interesting in an infographic, and you may end up doing that by hand. Also, again, as you get more deeply into data analysis and you have different subject areas that you want to combine, we want graphs that show relationships between data. So regression analysis you may have heard of, and that's where we'll plot one variable against another, and the scatter shows those distributions. So an example might be height versus weight, and we want to see, does weight go up as height increases? Or we might plot gross domestic product versus life expectancy to see whether, as you have more wealth in a country, the age at which you live to increases. And we also like to compare things by combining graph elements. So we might have bar charts for one variable and overlay a line chart to show a separate variable, and we'll label those separately on different axes. Coming back to why we do analysis just for a moment, I just wanted to mention the ideal data flow. So in an ideal world, we would have a policy or issue to be addressed, and out of that would come some targets to measure that issue or policy change. We'd have some indicators to measure that target, and these three steps would determine our data needs in a country, which in turn would determine what data was collected. Now, in reality, it often works the other way. So the data collection is done and some analysis is done in the hope that it feeds back to being used in something. So just again, depending on where you sit in this scheme of things, if you're in the NSO, you might be down this end. But if you're in this end, make sure you're talking with the people at this end and that you're coordinating your respective needs to each other. And that's why the Sustainable Development Goals, while they are a massive impost on the statistical systems in countries, they are actually a really nice framework in the sense that they flow nicely. So we have our 17 goals, which are a headline desirable outcome, and beneath each of those goals sits some targets, and within those targets we have some defined indicators. So they all roll up to meet that overall goal, and in the end at the Agenda 2030. As I said, they are a bit of a blessing and a curse because they've put incredible demands on the Pacific National Statistics Offices, and those demands are not always realistic. But from an analysis point of view, they are really helpful because the indicators now all have a defined methodology, which is what sits in what we call a metadata. So if we're interested in a particular indicator, we can go and see the methodology. There's some recommendations on what the preferred data source is to calculate it, and there's also some text around how we should interpret the indicators and a justification for why the indicator is important. So this can really guide what analysis you do. So let's just have a quick look at an SDG data flow. Let's look at Goal 7, which is affordable and clean energy. Within that sits one of the targets, which is universal access to modern energy. And to measure that target, we have an indicator, which is the proportion of population with access to electricity. So that's all a simple progression and an easily to understand indicator. So the indicators range from easy, such as this one, which we can readily calculate from the census because we have a question on access to electricity and we know the population. But the indicators can also be incredibly complex, like this one from goal 1. So again, the goal is no poverty. The target now is to reduce poverty by at least 50%. So we see we've switched to a target where we're going to have to need at least 2 data points because we have to have a baseline and then we have to say, have we achieved reducing that by at least 50%? And the indicator itself, and we say proportion of men, women and children. So already we've got 3 sub-indicators of all ages. So that's another minimum 2, 3, up to 5 categories. Living in poverty in all its dimensions. So we've got to look at monetary poverty, food poverty, access to services, and according to national definitions. So we don't even necessarily have a global methodology to follow. So you can see that there's quite a range in complexity in the SDGs. Just for interest, I looked at what sort of indicators make up the Pacific set of SDGs. So this is a set of 131 that the region prioritised out of the global indicator framework. So again, this is a tree map where the size of the box represents the frequency of that indicator type. So immediately we can see that proportion is the most common type of indicator, and that's things like our proportion of people owning a mobile phone, proportion of people who have access to safe drinking water, proportion of schools with adapted facilities. So they're usually our straightforward indicators. There's also a nice contribution of indicators that are purely just a number, and that might be the volume of aid that a country receives. And the yes/no's are the simple ones, such as, does this country have a policy on climate change adaptation, for example. Rates are also common, and a lot of that is in the health indicators, so mortality rates, for instance, and also the incidence and prevalence, where we're looking at, with incidence, the new cases in a year, and the prevalence for things such as stunting and wasting in children, where we want to know prevalence, which is the total number of cases as a rate in the population. And we have a few scale indicators, where that means after you've collected all the data, that gets moulded into a scale from, say, 1 for low progress up to 5, which is high progress. You'll be glad to know it's my final slide. It's just to illustrate that you can actually have some fun with statistics and make things up. So this is an interpretation of the most used phrase of 2020, and I think it's highly appropriate given all the time we're spending on Zoom. So I really appreciate your attendance and hope that we've covered off some things for you to consider as you progress in your data analysis journey. So thank you and take care.